Mindfulness. Mindfulness has been practiced for over 2,000 years. Mindfulness originated from Eastern Buddhist traditions. These meditations were for letting go and freeing the mind. Mindfulness requires repetition and practice. With practice and repetition, fMRI studies have shown that mindfulness can actually produce positive changes in your brain structure. This neuroplasticity is what we as OTs strive for. As OTs, we must use mindfulness in our theory and educate and train our clients to create new experiences and new neuronal connections. New research also suggests occupational therapy and mindfulness may support each other during the rehabilitation of physical dysfunction, neurocognitive and neuromotor disorders, geriatrics, and pediatrics. The purpose of mindfulness is to direct the patient towards thoughtful movement and help them understand their individual mind-to-body connections. To understand the why behind mindfulness practice and how mindfulness will help individuals in their personal lives, we must understand the way stress affects the body. Stress is harmful in many ways, and the body will naturally create and release neurotransmitters when the sympathetic nervous system is activated. During fight or flight responses, this is seen with increases in cortisol, and cortisol can be a major enemy against most neuronal processes and has a negative impact on basic body homeostasis. This last month, it has been exceedingly important for me personally to use mindful practices. As a student in the grad school, as a mom of an 8-year-old daughter, as a wife to someone who does have a few disabilities, I found myself anxious and stressful and overwhelmed. A lot of times I couldn't remember things like I was supposed to or be as organized as I should have been. I can see easily why, if we have a client whose natural state has been disrupted by an illness or an age-related change or some type of stroke or physical problem, meaning like has lost the use of a leg or an arm, that we need to introduce mindfulness to them so that they may be able to relax and adapt easier to their new circumstances. Stress can be extremely hard on one's body. Anxiety is usually because someone is thinking about the past or the future. And when we use mindfulness techniques, which means to clear your mind and center your body for 3 minutes, 5 minutes, 10 minutes, to be in the present and not worry about anything else, and to really feel your body and what's going on with it, then it has been known to reduce that anxiety and to calm the body, to lower blood pressure, to have greater impacts on breathing and sleeping. Then we're able to actually help the patient. They can sleep longer. We can work with patients on their sleep cycles. A lot of times patients with anxiety sleep too much because of depression, or they sleep too little because their mind won't shut off. With mindfulness, we can show them techniques on how to be more aware of now so that they're calmer and so that the thoughts of the future don't work them up, and so that their body is capable of going into their natural sleep patterns. We also need to be aware of pain when we're dealing with our clients. A lot of times when someone is in pain, they're so afraid of feeling that pain that their body is clenched up, it's tense, it's flexed, it's not relaxed. And that does no good for the patient. Not only is it psychologically damaging, but it also makes the pain more intense. So as OTs, we need to bring them into the moment. We need to tell them that yes, there's going to be pain, but we can deal with this, and we need to be present so that the fear isn't making the pain bigger than what it is. And that way they're able to loosen their body, and that it relaxes them just a little bit. It doesn't take away the pain, but it relaxes them enough so that they know they can handle it and they can process it, and then they can deal with it in better methods. And so it's not so overwhelming. Another thing we need to work on is self-awareness in general. We need to know that, well, a great example of this would be our clients who have incontinence. If a client has incontinence and they're not aware of themselves, then their incontinence becomes more frequent. So we can introduce mindfulness as a tactic to make them more aware of themselves in every way. So even incontinence, even though yes, it may still happen, it may not happen as frequently, and it gives them a sense of control over their body. There are so many ways that as OTs we can use mindfulness with our clients. But more than that, in this time, I would like us to use mindfulness for ourselves for the next 2 weeks as we take our final exams and we do our neurocompetencies and we do our TED Talks and we do our range of motion and manual muscle testings. We need to focus on our own mindfulness. We need to take care of ourselves. We need to breathe. We need to relax. We need to sleep. We need to clear our mind, live in the present so that we can focus on our future and we can be better OTs. Thank you.